I like it because it shows all of the factors that are involved in, supposedly involved in the regulation of body weight. So you see gut and also pancreas and liver, food intake itself, and the brain and all the areas of the brain, and energy expenditure. And what's interesting about Mike's approach, and this is also my approach, is that the summation of all of these organs and activities all are focused on the adipose tissue, and the adipose tissue can be seen as a very flexible compartment or flexible organ in this process. In fact, more than flexible, actually passive to the extent that it receives excess energy and can also mobilize that energy. Consistent with the point of view that the adipose tissue is a passive recipient of energy coming into the body, determined by the rest of the energy regulatory system, you have these phenomena which we know about. But basically, if you manipulate nutritional factors for individuals at a stable body weight, and this could be animals or humans, what really changes primarily is body fat. Body fat decreases during periods of underfeeding and increases during periods of overfeeding. And what's interesting is that body fat mass will always go back to its original level. We call this set point. Just a word on the concept of set point. As a descriptor of maintained body weight, it's fine. There's no problem using it. Some investigators use it to imply a biological mechanism, and we haven't really identified a set point mechanism specifically at this point. We know a lot of factors that contribute to it, a lot of pathways and hormones, but we really haven't identified a biological set point mechanism. So the use of the term as a descriptor is fine. When you're using it to talk about mechanism, you have to be careful. Now these changes in body fat mass even occur when you permanently increase body weight, and this is really primarily body fat again, by using overfeeding or a hypercaloric diet. So you can drive up body weight in humans or rats, and I think Mike's time scale here is humans because he has years. You can drive it up with hyperalimentation, overeating of a hypercaloric diet, and body weight will reach a new level if you maintain this stimulus, this hyperalimentation, long enough. You'll have a new permanently elevated body weight or elevated set point. And you see these changes to nutritional manipulations even in this case. So if you food deprive animals at their new set point or their new maintenance body weight, if you deprive them, they will drop in weight, and when you release that manipulation, adipose mass restores to its previous level. Considering all of these observations, we really have to ask the question that we started out with, and that is the adipose tissue compartment passively maintained or actively regulated?